Let's study 4 short repeat MCQs in 4 minutes. This is the mechanism of the injury what we are going to discuss today. First question. All of the following statements are true about diffuse axonal injury except it's all India repeat. First MCQ option, caused by shearing force. Second, predominantly white matter hemorrhages in basal ganglia and corpus callosum. Increased intracranial tension is seen in all cases, most common at the junction of grey and white matter. So let's decode and break each option and study this topic of diffuse axonal injury. As we saw the image, this is the mechanism of injury where there is acceleration followed by deceleration, and we can see how the brain is moving completely inside the skull, and that's when patient suffers a diffuse axonal injury. There is an acceleration and a rapid deceleration. The points to be noted here are: this is the gray matter, this is the white matter, and this acceleration deceleration causes shearing injury. So there is a break here and it involves the white matter. Now single slide, 6 MCQ points. Let's see. So the first thing first, what we see, it's a MRI image. Hence investigation of choice is MRI. Now this indicates severity from left to right. The first image shows hemorrhage in cerebral hemisphere, second one in corpus callosum, and third one in brainstem. So these are the sites, and it's a Adams classification. As you go from left to right, the injury severity increases from mild, moderate to severe. And where does it involve? It's a white matter hemorrhage, as we saw in our last slide. Cerebral hemisphere, corpus callosum, and brainstem. So here comes our next MCQ point. Duret hemorrhages. Where are they seen? Brainstem. And final point, which can be a future MCQ option, it predicts the length of comatose state and persistence of deficits. What? We are talking about MRI. So now let's see the MCQ options and solve it. Caused by shearing force, yes. It involves white matter hemorrhages, yes. The sites we have discussed, basal ganglia, corpus callosum, and brainstem, true. Most common at the junction of grey and white matter, yes. Increase intracranial tension in all cases, no. Wherever you see an option with all or none, that is likely to be the answer. Next, Duret hemorrhages are seen in, now we know, brain, in that brainstem, and in that pons is the most common site. This is a recent NEET MCQ question. Retraction ball is seen in which of the following? Burns, acute pancreatitis, diffuse axonal injury, and tracheobronchial injury. Let's see with the help of this image, which can be a future MCQ image question. So what you see here is ends of axons getting retracted because of the shearing to form ball-like swellings, and these balls we call it as retraction balls, and it's a forensic findings of diffuse axonal injury. Let's see what was the question. Retraction ball is seen in diffuse axonal injury. Coming to a final question, neurosurgery is indicated in all except EDH, SDH, DAI, and depressed fracture. If you have not seen my previous videos on EDH, SDH, and depressed fracture, please have a look. And now we know, because it's a diffuse injury, it is not an indication for surgery.